Hey everyone, today we're going to cover tuberculosis, also known as TB. So it's one of the oldest diseases known to humanity and is still a major global health threat. So TB is a common infectious cause of morbidity and mortality worldwide. So what is TB? So TB is caused by Mycobacterium tuberculosis, and it's a slow-growing bacteria that typically affects the lungs, though it can spread to virtually any organ in the body. Here's what makes TB unique. It's transmitted via airborne aerosol droplet nuclei. When someone with active TB coughs or sneezes, they release these tiny droplets into the air, and when the patient breathes them in, they can become infected. But here's the interesting part. Most people who get infected, they don't actually get sick right away. In fact, primary infection is often initially asymptomatic, so the patient won't know they even have it. So this is because of their immune system, specifically the innate and cellular immune responses, keeping the bacteria in check. So this brings us to a crucial concept: latent TB infection. When Mycobacterium tuberculosis is dormant in the body, not causing disease, that's called latent TB. So the bacteria are there, hiding inside the macrophages and the immune cells, but they are not actively multiplying or making the patient sick. So they won't be contagious, and they won't have any symptoms, and they would feel completely fine. However, if the immune system becomes compromised, maybe from HIV, chemotherapy, malnutrition, or chronic steroid use, reactivation can occur. So when the bacteria start multiplying again, the patient develops active TB. So this is when they become sick and contagious. So it's estimated that about 1/4 of the world's population has latent TB, but only 5 to 10% will develop active disease in their lifetime. So the key risk factor is anything that weakens the immune system. So how does active TB present? Think of a classic constitutional symptoms like fever, significant weight loss, and drenching night sweats. So we were talking about waking up with the sheets soaked. So the respiratory symptoms are key: a productive cough that lasts for weeks or months. So this cough doesn't respond to conventional antibiotic therapy. So if the patient have tried regular antibiotics and the cough isn't improving, so you should think of TB. Some patients also experience hemoptysis, that's coughing up blood, which happens when the infection erodes into blood vessels in the lungs. Now, while TB typically affects the lungs, what we call pulmonary TB, it can spread hematologically through the bloodstreams to any organ. This is called extrapulmonary TB. You can get TB meningitis affecting the brain, TB of the spine called Pott's disease, TB lymphadenitis affecting the lymph nodes, or even TB affecting the kidneys or bones. So disseminated TB, where it spreads throughout multiple organs, is rare and typically only occurs in severely immunocompromised individuals like those with advanced HIV. So diagnosing active TB requires several approaches. First, we get imaging, usually an X-ray, which might show upper lobe infiltrates and cavitary lesions or miliary pattern with tiny nodules throughout the lungs. But to confirm TB, we need to identify Mycobacterium tuberculosis itself. So we do this through sputum samples. Microscopy with acid-fast staining can show the bacteria right away. So though this it's not very sensitive, cultures are the gold standard. They take 2 to 6 weeks because Mycobacterium tuberculosis grows very slowly, but they are highly accurate and allows us to test for drug resistance. So PCR, or polymerase chain reaction testing, is the newest method. It's fast results in hours and highly sensitive and specific. It can even detect drug resistance strains quickly. So for latent TB, we use different tests like the tuberculin skin test, or TST. That's the PPD test where the patient is injected with tuberculin under the skin and measure the reaction from 48 to 72 hours later. So, or we can use the interferon gamma release assay, which is a blood test that's more specific than the TST. So let's talk about the treatment. So why is TB treatment so long? So there's three reasons. First is that Mycobacterium tuberculosis grows incredibly slowly, and second is that it hides inside macrophage where drugs have trouble reaching it. So the third causes it has a very thick waxy cell wall that drugs struggle to penetrate. So for active TB, we use combination therapy to prevent drug resistance. So the standard regimen is called RIPE, and rifampin, isoniazid, pyrazinamide, and ethambutol. So the patient takes all 4 drugs for the first 2 months. This is the intensive phase. Then we continue with just rifampin and isoniazid for an additional 4 months, the combination phase. So that's total 6 months. So why 4 drugs? Because using multiple drugs prevents the bacteria from developing resistance. Each drug works differently, attacking different aspects of the bacterial metabolism and cell wall. So for latent TB, treatment is simpler, but just as important. We typically use isoniazid alone for 9 months, or rifampin for 4 months. So why treat latent TB? It's usually because treatment reduces the risk of progressing to active TB by up to 90%. So this is crucial for TB prevention and control. So if you found this helpful, hit that like button and subscribe for more medical contents. Drop any question in the comment below and I'll be glad to answer them. So stay healthy, and I'll see you in the next video. Bye bye.